I found that the alternative approach that I've been following to be much more beneficial, because it looks at the body and the person in the round.
Alright, okay. That sounds like a lot of work that you have to go through just to change your lifestyle and everything. So how does it feel also compared to a normal conventional medical approach that when you receive treatments, it's more passive? You go there, you get the medications, you get the therapy, chemotherapy, whatsoever. But in this approach that you have to change everything around you, is it practical in a way, or do you think it's what humans should be doing?
I would say what I learned for myself from going through this process for over a year is it's very empowering. It means that you are working with the doctor, Dr. Pilant in my case. You're not being done to. It's a process whereby, for want of a better word, you are very much in the driving seat, and the level of success of this protocol is really to do with the way in which you approach it, and the way in which, like everything, you make mistakes, or you don't tick all the boxes every day, every week. But if you do fall back a little, then you say, okay, right, what do I need to do to put this right? The great thing is to have the support from people like Dr. Pilant, but it's not enough to have the support. You must take control of this, and you must see it through, and you must continue to make sure that, again, to talk about the long term, that you do what is necessary to look after and treat your body properly.
And I think also one thing you haven't mentioned is having that healthy mindset and the positivity, because that's helped you through tremendously. I think you might have underestimated how you were at the very beginning when you were diagnosed, because it was a quite dark time for you, especially as you had a very good friend with stage 4 cancer, so who we did lose this year, and it sometimes feels a little bit it's difficult to get out of that depression or that circle, because when you're listening to the doctors or listening to the Western diagnostic side of things, you get drawn into it, because these are very professional people that want to help you, and it all sounds very
well, the obvious thing to say is that I'm sure people watching and listening to this will know from their own experience is, again, I stress because of where I am in the UK, the doctor is always right. So if the consultant says the only way to deal with this issue is invasive surgery and a biopsy, and then this is the next stage after that, it is very easy to just to comply with that and to go along with that. And one of the things that I struggled with was the idea of questioning, is this the only approach? And having done the research and finding out, no, there are other approaches, like the approach I've taken with Dr. Pilant.